Hello, welcome to my channel. It's me, another doctor on the internet. Um, Here I am. I'm here to tell you who I am, what I do. I work in a narrow, tiny sliver of medicine, which I'll tell you about momentarily. I see a lot of doctors on the internet, like dermatologists and pediatricians and other people telling people about various medical conditions, but I haven't really seen anyone like me. And my patients tell me that what they're dealing with tends to be pretty significant, and what I do isn't that uncommon. So I thought someone needs to fill in the gap, fill in the void, and walk people through various medical conditions that I see. I'm kind of a chill, laid back guy. You're not going to see any like high production value around here. It's just me. There's my iPhone and a $30 microphone I got from Amazon. Um, I don't know what I'm doing. I just feel like I need to be part of the conversation. That's all. So, my name is Zach Oakey. I'm an ophthalmologist. I'm also a retina specialist and an ocular oncologist. And I'll walk you through what that is in a minute. That's me. That's a photograph that was taken of me during my first fellowship. I was well rested and happy, and no, I was really stressed out, but I mustered out a smile. I'm quite proud of that. No, I'm glad I have undergone various things in my education. But that's, like I said, that's my address. Work in Irvine, and that's my building. So the first thing to say is, what is an ophthalmologist? People use the word eye doctor a lot. And when someone says eye doctor, they generally mean a bunch of things, or they can mean a bunch of things. So I just want to clarify some terminology before we get into like what I do for a living. So first, an optician. An optician is someone who works on glasses. They basically make sure that glasses fit right. I'm sure they do a bunch of other stuff, like for example, they make sure that the pupil in the eye is right where the glasses should be, and so on. They make sure it fits. That's pretty much it. An optometrist is someone who's really smart. These people go to college and then they go to optometry school. Optometry school is kind of hard to get into. And optometrists, what they learn to do is take care of the eye in sort of like a primary care way. That is, they can examine the eye, they can dilate the eye, they check the vision, they can prescribe certain medications. They also do glasses and contacts. They can take pictures of the eye. Their expertise ends at a certain point. If someone needs surgery of the eye, or if they need more intense medication, some kind of more intense intervention, then someone will then be referred from an optometrist to an ophthalmologist. Now that's where I fit. An ophthalmologist is someone who goes to medical school after college. Medical school is where we learn all about the body. Uh, that's where future pediatricians and cardiologists are, future gynecologists. All these people are my friends. I have friends in all of those disciplines who went to medical school with me. And then once we graduate medical school, we go and do something called residency, and that's called ophthalmology residency. We learn about the eye's relationship with the body in more detail. We learn about how to perform surgery for the eye, various medications of the eye. We learn about how to treat someone ethically as a continuation of what we learned in medical school. And then a lot of people end their whole medical education right there. They finish residency and they become what's called a comprehensive or a general ophthalmologist. And these people are most known for doing things like LASIK and cataract surgery. They'll treat glaucoma and eyelid problems, stuff like that. But I did that, and I went to residency, but I decided to move on even from that. See, I don't even do like cataract surgery or LASIK or treat glaucoma. I decided to do what's called a fellowship after residency. A fellowship is extra additional training in one tiny little narrow sliver of medicine. And I did two fellowships. I did one in retina medicine, retina surgery, and I've done a second one in eye cancer, ocular oncology. I'll tell you what the retina is in a minute, but it's basically a way of treating people who have a particular condition in a particular part of the eye. And the things that I tend to treat, they tend to be devastating, even potentially blinding. A lot of my patients, I meet them while one or both eyes are blind. And then I fix it, and I'm quite proud of the work that we do. There's no talk in the eye without reviewing the anatomy. So just to give you a sense of like where I work. So within the eye here, it's a nice little cartoon. There's the cornea. A lot of people know the cornea because that's where we do LASIK. There's the lens, and in the back of the eye, filling the entire back of the eye, is this thing called the retina. Next to and connected to the retina is the optic nerve. And this is like the basic structure of the eye. Now, for vision to happen, the cornea and the lens, and maybe contacts or glasses, they focus light onto the retina. And the retina feels the light. It's like a satellite dish. It's like if you think of the eye like an old-fashioned camera with like lenses and film, this is the film of the camera, or in this case, this is the retina. So the retina is this big thing. It's kind of complicated. Well, big for me anyway. The eye's always small. This is a picture of an average retina. This is the right eye. In the middle of the retina, there's something called the macula. There's also the optic nerve, and there are blood vessels everywhere. We tend to find problems of blood vessels all the time inside of the retina because there's so many here. It's a very blood vessel rich organ. We also tend to find inherited conditions and mechanical conditions. And I'll walk you through a couple examples. Here's one example. This is a largely genetic condition called macular degeneration. It's a thing that affects a lot of people. It affects the very middle of the retina, what we call the macula. Within the macula, when someone has something called macular degeneration, there are these like yellow creamy spots. I'm going to have other videos on this subject. Suffice it to say, some of these people are my best friends. This is a very common cause of legal blindness for some people in the United States. This is another example of something I treat. This is a blood vessel abnormality. Remember I told you that there's so many blood vessels in the retina and there's some conditions that come just from blood vessel problems. This is an example. In this person's case, there's a vein right in the middle there that's taking blood out of the eye, but it's having a hard time. It's called a retinal vein occlusion. This person probably doesn't see too well, and I treat this problem quite a bit. This is a mechanical problem of the eye. In the very middle of the retina, in the macula, there's a hole right here. And if we scan right through that hole using some special technology, we can see that there's a hole right in the middle of the retina. This is called a macular hole. We fix this with surgery, for example. There's another example of a mechanical problem of the back of the eye. This is a retinal detachment. So what happens, a retinal tear forms right here, and when the retina rips like this, all the fluid that's within the eye can go into the rip, and it can cause the retina to detach. There's our old friend macula in the middle of the retina there, and the entire retina is detaching, and it's kind of cutting the vision in half. The bottom half of this person's vision is probably blind. So these are things that I tend to treat. Now remember I told you that I'm also an ocular oncologist. That is someone who treats cancer of the eye. These are just some examples of some things that someone like me would see. For example, on the ocular surface, this person has melanoma on the surface of their eye, and I tend to treat that. Melanoma can happen in other parts of the eye. For example, this is the very back of the eye. There's a melanoma under the retina for this person, and I treat that as well. Now, these are cancers that are specific to the eye, but there are some other cancers that can happen throughout the body, and it's important for someone to recognize some of these things, and if they're recognized, then be seen by an ocular oncologist. Like, for example, on the bottom right here, this is a person who has breast cancer, and the breast cancer moved from the breast, went to the armpit, has gone to the other side of their body, and then the cancer has moved everywhere in a process called metastasis. But also it went to the eye. In this person's left eye, there's metastatic breast cancer right there. Now the bottom left image is an interesting image. This person has no complaints in their vision. They probably went to like an optometrist and got a random photograph of their eye, and this spot was detected. The interesting thing about this spot is if it shows up, this can mean a lot for someone's life. You see, there's a condition called Gardner syndrome or familial adenomatous polyposis. It's a situation in which someone is at really high risk of colon cancer, among some other cancers. And when we examine the eye, we will find these very prototypical spots where there's like a brown lesion and then a little area where the retina is kind of missing right there. If someone shows up to my clinic and they're like 30 years old, my immediate recommendation is get a colonoscopy and test your family and so on, because the risk of cancer is really high. You'd think like an eye doctor really wouldn't be commenting about someone getting a colonoscopy, but in the world of eye cancers or things that can indicate the risk of cancer elsewhere, we tend to treat that as well, or at least make certain recommendations. So anyway, that's me. I'm an ophthalmologist, a retina specialist, an ocular oncologist. This is my clinic and website. If you're ever in the neighborhood, feel free to reach out. I look forward to interacting with you. Thanks.